Hey guys, it's Dr. Nate here at Thrive Dental Orthodontics, and today what I want to do is review The Little Shop of Horrors. And this is a movie, I think in the 1986 it was made, and it stars Steve Martin as this kind of like crazy dentist. And I think this movie is hilarious, and I haven't watched it forever, but I want to review this one part that shows him kind of coming into the dental office, and maybe there's some truths in it, and maybe there's some myths and lies. And so I want to try to clear everything up and just do a little kind of funny review. So let's go. Let's take a look.
You'll be a dentist. You have a talent for causing things. Some be a dentist. People will pay.
Number one, I'm pretty sure you can't walk in, the dentist can't walk into the office and start punching their dental assistants. Maybe you could do that in 1986. You definitely cannot do that now. So that is probably the first thing that is not necessarily true.
People will pay you to be inhumane. Your temperament's wrong.
Probably can't rip off dolls' heads either.
And teaching would suit you still.
Okay, this is interesting. He's actually grabbing an instrument that we use even now. I have a couple instruments in front of me, so this is one that's actually very similar. And I know this is gonna look kind of scary, but this is an instrument that we use to take out teeth, and it actually looks very similar to the one that he's using. So there you go. There's some things that haven't changed that much in a long time. Obviously, one thing that he's doing a little bit differently is he's not using gloves, which obviously we do that now, and he has no mask, but of course he can't have a mask if he's trying to sing, right? But yeah, so obviously you need masks, you need gloves, you need the proper protection, but the instruments are kind of the same.
And teaching would suit you still. Some be a dentist. You'll be a success.
I think number one is obviously he's just coming in from the outside, so he hasn't seen this patient. He hasn't given any anesthesia. There's no numbing. There's nothing like that. So you would obviously need to numb a patient before you go in there and try to take out a tooth, unless you're trying to inflict a lot of pain. So he is also doing kind of like a twisting motion like this, but that you do not do with these type of instruments. These are more kind of like a back and forth type of instrument, or just pulling out type of force, but there's no real twisting. You do sometimes use twisting if you have something like this. This is an elevator, we call it, and you just do kind of like a twisting motion, sometimes on the side to elevate the teeth, but definitely like never jabbing in and twisting and then kind of holding it there. That doesn't really make sense. So there's a lot of things so far that aren't adding up totally, but it's interesting. No, this is actually kind of a crazy thing. I know I'm stopping a lot, but we have this a lot where patients are really nervous, and so they won't scream like that, but they're kind of nervous. You know, they're nervous about the whole situation. And if they're screaming like that, you absolutely stop. But even when I'm doing braces, when there's no needles, there's no drilling, I'm gluing stuff on the teeth, patients sometimes will be scared. And so I'll have to stop and let them know, like, hey, if you're nervous or scared, I can stop. I'm totally fine with that. But you need to let me know, if it's something where you're just a little bit nervous, but you want me to continue, cool, we're going to keep going. But if it's nervous and you're in pain for some odd reason, obviously with braces, there's not much of this, but sometimes in dentistry, you need to let if you're a patient, you need to let the doctor know so that they can stop, because they can give you more anesthesia. They can, really numb you up, maybe give you some laughing gas to help you out. So if you're screaming like this, not very good, but it does happen sometimes in the dental office, which is scary. Okay, so let's continue.
Here he is, folks, the leader of the flat. Watch the sucker black ass. Oh my God.
Okay, so obviously he is using
nitrous or laughing gas, which we still use. It's super safe, so we use it basically every single day.
Laughing gas is amazing. It helps not the doctor, but it helps the patient relax a little bit, and it's kind of it's honestly similar to being a little bit drunk, but it's quick. Like as soon as you take it, you're in that state. As soon as you're off it, you're off of that state. So it's really, really quick acting and quick to be gone as well. So it's really, really a great kind of substance that we use all the time. He's also about to inject this patient, when we really never inject without putting a topical anesthetic on first. So if you come into any of our offices, or probably your own dental office, they'll put some rubbing stuff on your gums, some gel, and that is topical anesthetic. so that when you put the needle in there, you don't feel it. And you know, we're never really supposed to show patients needles, but they do not look like that. This is the needle. I know it's actually kind of scary. It's kind of big, right? It's kind of scary. But that is what a dental needle looks like. And laughing gas is not meant for the doctor, but it is meant for the patient. And it helps out a lot, actually.
Who wants their teeth done by the Marquis de Sade?
Oh, that hurts! Wait, I'm not numb!
Shut up. Open wide. Here I come. I am your dentist.
So yes, obviously the patient knows better. You have to wait a couple minutes for the anesthetic to kick in. It's not like you can just inject, boom, and like you're super numb. It doesn't work like that. So yes, you need to let it sit a little bit. That's why you'll see the dentist come in there at your office or our office, numb, suit you back up some of the times, and leave for 5-10 minutes, because really we just want to have that anesthetic kick in. It's not that we have something else to do. We just want it to kick in. And obviously this patient, I think, knows that, and he knows it hasn't kicked in. And this is an interesting view that we got from the mouth here. This is interesting.
And I enjoy the career that I picked. I'm your dentist.
Obviously he's not wearing a mask.
And I get off on the pain I inflict. I thrill when I drill a bicuspid. It's swell, though they tell me I'm maladjusted. And though it may cause my patients distress, somewhere in heaven above me, I know that my mom is proud of me.
Okay. So we probably don't have a shrine in your dental office, or your dentist probably does not have a shrine to their mom, grandpa, whatever. But it's true, like a lot of us, and I know a lot of you respond to this. This is like one of the most common things people talk to me. They say that they are doing things for their parents, they're doing things for their grandparents, they're doing things for their family. And this is pretty common. Obviously, we won't have a shrine in the office. Well, I don't think many people do. Maybe they'll have a picture. But it is true. You know, a lot of times we're doing things to help or to kind of satisfy our parents, which I don't think is necessarily correct, but that's what a lot of people do. And this is just like a played version of that, which I think is pretty funny. It's pretty clever.
I know that my mom is proud of me.
Mama?
'Cause I'm a dentist and a sick cell. Say ah. Say ah. Say ah.
So he's using the air water syringe right now, which is actually basically the exact same thing that we use. So this is very, very normal. Obviously, still not wearing gloves or masks or any of that stuff. And a lot of times we'll have people open up, spray some water in, rinse, and then suck it out so that they can get all this kind of nasty stuff out of there. So that's kind of normal. Obviously, he's torturing the patient a little bit, so that's not good. But still, he has the air water syringe.
Now spit.
So there you go. That's like a little quick review of the Little Shop of Horrors. I think that clip is hilarious. There's tons of funny stuff in there. Steve Martin is a genius. Guy's hilarious. So if you enjoyed this, if you have anything else you think I should review, maybe we'll do some memes or something like that that involve dentists or orthodontists. Shoot me a comment below so I can help you guys out. I can answer those. And once again, if you have any value in this, please subscribe. I am putting out videos weekly. And so I will see you guys soon.